To tell us a little more about concussions. Hi, Edwin. Thanks for being here this morning.
Good morning. Thank you for having me.
Of course. So, high number of head injuries when it comes to kids in the summer months. Why do you think that is?
I think in general in the summertime, kids are out of school. You have kids outside playing, riding bikes. You see the jump bikes, jump scooters running around, soccer, football. All those things kind of happen to start to take place in the summer months. And so there's definitely a higher risk with the increase of outdoor activity.
Okay.
Yeah. And so what we want to do, though, is kind of get an idea on how to spot a concussion. But first of all, people may not even know exactly what a concussion is. I know you have a skull right there.
I do.
What is a concussion, actually?
Well, so a concussion is any disruption in normal brain function. Okay, so caused by a blow to the head, whether it's direct trauma, a blast, sometimes in the military. And what you see is loss of consciousness or any altered level of consciousness.
Okay.
So you don't necessarily have to be unconscious, in a coma to have a concussion or...
Will they have headaches or anything?
Headaches are a common sign.
Okay.
But when you watch sports sometimes, for example, you see a player get up from a hit, and they may be a little wobbly, unsteady on their feet. That is enough to define a concussion.
Oh, wow.
That just unsteadiness. Oftentimes, patients will describe kind of being in a daze, feeling confused for a short period of time.
Okay.
Even those kind of gaze in a fog, I should say, not a gaze, in a fog are kind of those symptoms of concussion.
Should parents take the kids right away to emergency?
So it depends. There are a few signs to watch out for where you should definitely seek immediate attention, especially in younger children, children that may not be able to communicate. If you see kind of a lower level of activity from their baseline, if they don't return to that right away, or if they have signs of headaches that are getting worse. Nausea and vomiting is a big sign, right? Continued nausea and vomiting. And then difficulty to arouse. Those are all kind of emergent symptoms. If they're having trouble waking up from that nap after the concussion, that's a sign where you should seek immediate attention.
I mean, I've heard crazy stories to where someone might get hit with something soft, like a beach ball or something, and there's not immediate signs, but maybe a few days later, in fact, it was a big deal, and it turns out to be a concussion. I mean, parents, I don't know, should they, Tina, that's a good question, should they just jump and take them to the ER every single time something happens?
Well, those mild concussions, a beach ball, hitting heads on the playground, if you do notice those signs right away but they get better, it's still important to at least contact your pediatrician, because kind of guiding the return to play, return to school, those decisions should be made, with the help of a pediatrician, or your physician. Because what you don't want to happen is a second impact. So really what studies have shown is really those follow-up impacts could be more devastating, where you do kind of progress to the realm of, severe brain swelling, where then you would need to see a neurosurgeon, and that's what I don't want to see. I don't want to see young kids in the ER where I have to, intervene, meaning, do some sort of procedure to relieve that pressure. And in worst cases, we have to evacuate hematomas. So all these things kind of happen during the summer months, and we do see a rise.
So last few seconds here, final advice to parents.
Final advice, watch your children, watch out for these symptoms. In terms of prevention, helmet safety is important, and as well, UC Davis also offers free car seat inspection, because again, motor vehicle crashes are still, one of the leading causes of traumatic brain injury, in children.
Okay, well, thank you so much.
Yeah, and of course, all the information, if you need any information, UC Davis Health will be the place to go.
Yep, thank you.
Dr. Edwin Kalubia, thank you so much
Appreciate it.
for coming in.